This is Curious Minnesota, a Star Tribune project that sends staff from the state's largest newsroom hunting for the answers to great questions we receive from you, our readers. We're here to answer everything you want to know about the state's people, places, and culture.
Welcome to Curious Minnesota. I'm your host, Eric Roper. Today's episode of Curious Minnesota is sponsored by Primrose Schools. Our show today is about a particularly important topic. We'll be discussing the evolution of mental health care in Minnesota, which has been a difficult public policy issue for many decades. Like many states, Minnesota closed the controversial institutions that once housed mentally ill people here. But the plan to replace these facilities with new types of treatment options remains incomplete. Reader Nick Johnston wanted to know more about the transition away from institutions, which were officially known as state hospitals, and he specifically wanted to know how much of the savings from closing those facilities was used for community mental health care. Here's Nick.
I asked the question because I've worked in mental health my whole career of about 48 years in mental health. I've seen a variety of changes from the old state hospital days to community mental health systems, both in Illinois and Minnesota. I'm curious about things that have gone and are going not only here, but nationally and in other states as well.
Thanks to Nick for that question. I'm talking today with reporter Chris Snowbeck, who covers healthcare for the Star Tribune. Well, Chris, thanks so much for joining us today. So first of all, this is one of the unique things about the Star Tribune. You have immense expertise in this area, in the area of healthcare.
Yes.
Not everybody covers a beat for 3 decades. What have you been covering for 3 decades?
Yeah, it was a poor decision.
And you haven't always covered it here, but at various papers.
Right. The through line has been I've written a lot about insurance over the years, and like the money in healthcare over the years. But I've also written a lot about public health. Used to write a lot about solid organ transplant program, like liver transplants. So
you wrote a lot about that.
A lot about that. But lots of different stuff. And then since the pandemic, like for obvious reasons, I think mental health has been an area of interest for me.
And you actually wrote a series about the current issues around what we're talking about last year?
Yep.
Okay.
Yep.
And we'll link to that in the show notes so that people, if they want to read, it's a 3-part series.
That's right.
Okay. So this question, we've been talking about this for a couple weeks or even months, I guess now. Super complex topic. And also just, I feel like the issue comes up and people kind of like, what happened to the institutions? Like there's kind of this lingering question that I feel like has come up a bunch of times. And this story was so important, I feel like, because it really did help illuminate this really complex process of how this all evolved over time.
Yeah, I think that's right. I think part of it to me is just the physical manifestation of care in these enormous old buildings, many of which are no longer with us. A few are still around. And it's a way to like size up or visualize this really complicated issue. So yeah, it's sort of intriguing. The other thing about these facilities, because since we wrote the story, some people have contacted me. I mean, every family has some connection to a bed in one of these old facilities. And so to me, as like a writer, I sort of think about, like a convening principle for storytelling. And I think about, if you took one room in Fergus Falls State Hospital and you could chart, who was in that bed over, a century. Right. My goodness, what an interesting set of stories you'd have.
Yeah.
So I think these facilities are super evocative of the history, the complicated history, and the enduring challenge of providing care for folks who need it.
Let's start the chronology. Chronology is our friend here with any complex topic. So we got to go back to basically right after statehood. I mean, like they're already saying in the 1860s, okay, we need to have a state hospital for people with mental illness. So this is like early priority.
Right. So I think Dorothy Dix in the mid-19th century is, going around, she's from Massachusetts, but going around to different states sort of kind of raising hell about the condition, the lack of a therapeutic approach. And so there's momentum in states to create hospitals.
So the first one is in St. Peter, which like almost was the capital of Minnesota, but we won't get into that. So for another episode. And then Rochester, Fergus Falls, Hastings, and Anoka. And those are like the big ones that happens over time. Yeah.
I think by the early 1900s, Anoka is open. There are other facilities we should mention. I mean, some of readers got back to me and said, why didn't you mention Wilmer? Why didn't you mention Cambridge? There's a lot of history here. So there were some other facilities too, but these are the 5 I kind of looked at.
And Fergus Falls, we were both taken aback by an actual photo we found here at the office of an aerial of that facility. I mean, it's still so large.
Right. Dr. Thomas Kirkbride, a Pennsylvania psychiatrist, thought that the design he created for these immense facilities were therapeutic in a sense. They were like these little universes. Not only was it this massive building, but some number of people there were like put to work, and they like created this little economy.
I mean, you mentioned they had a farm and things. So there's around 2,000 people there at the peak in the Great Depression.
That's right.
So let's talk a little bit about what's wrong with institutions as far as like the mid 20th century. After the war, there's a lot of attention put on this, both from our paper, the Tribune, and then Governor Youngdahl. What's the problem with these places? I mean, and then you also mentioned in the lead of your story, like another issue with them. But let's talk a little bit about who's ending up there. Is it just people with like severe mental illness, and what's happening to them when they're there?
Right. So the care, such as it is really restraint heavy, things that are not therapeutic, things that are, can be like punishment even, straitjackets and the like. The care, there's beginning to be lobotomies, there's beginning to be electroshock, and it's not at all clear that the intent with either is always therapeutic. The state of Minnesota in 1940, the federal government came in and gave like the state system really low marks particularly for excessive use of restraints. So it's not getting good marks on that score. In terms of the patient population, there were a lot of people, of course, who would sort of fit definition today of mental illness. But, there was a lot of folks who just ended up there for reasons that, wouldn't work today.
Right.
The gentleman who asked the question that prompted our story, he worked at a psychiatric hospital in Illinois back in the 60s. He said one of the first patients he interviewed, he said, well, why are you here? And she said, well, my husband talked to the alderman who talked to the judge, and they had me committed. And what she said was that she had inherited some money, and her husband wanted that money. And she could not get out of there until her husband said she could leave.
Right.
And these sorts of stories, they're throughout the history of these institutions.
Some people were like just sent away, basically, even if they didn't have, common or big issues mental health wise. Some of them, I mean, it's hard to say with any definitive like measurement of how many of each there were. Right.
A quick aside. So like there's this wonderful book that I quote Susan Foote, who's a public health researcher at the University of Minnesota. She's retired now. She wrote a book about 6-7 years ago called The Crusade for Forgotten Souls. And she found this gold mine, I think, of records from one woman who worked as an attendant in these facilities, who was an aspiring writer in a sense. And so she took notes every day about what she was doing, just her interactions with patients. And one that jumps out in memory for me was sort of a young woman who was pregnant out of wedlock, and the family just sent her off. And that woman had the baby, and they took the baby away, and she's still in the facility. And I mean, it's this tragic story.
Yeah.
But it's highly doubtful there was any mental illness that brought her there. But I mean, my goodness, the life experience of being in that facility, being subject to restraints, losing your kid. I mean, what a mess.
So this sort of starts to heat up reform-wise in the late 40s. So you get this Republican governor, Luther Youngdahl. Well, actually, I don't know which came first, but I mean, the Tribune has this expose, Minnesota Bedlam, we call it. And it's like showing this this terrible situation with restraints and all these types of things, right?
Right.
And Youngdahl's sort of like maybe around the same time. I mean, we have a picture on the story. He's burning straitjackets at some sort of press event, and so there's sort of an agreement between the media and the top politician. We got to do something about this.
Yeah, no, the Tribune stories really brought it to light locally. I mean, they came a year or two after. There's a really explosive expose in Life magazine. I mean, you get the idea that coming out of World War II, like the stateside press is like, oh, wow, look at these places.
So they make some reform.
Yeah, they make some reform. They're not necessarily enduring.
Okay.
I mean, that's
so things get, because I mean, I think we even like, there's pictures in our system of us going back and sort of doing these like before afters, like, oh, look how this kind of thing changed or that changed. Yep. But what you note in the story is that a lot of this didn't survive past Youngdahl's term, essentially.
Right. There was a change in political leadership, and some of the funding got taken, basically, or diminished. Okay. So better, but not perfect for sure, and right. Some backsliding. And it sort of sets the stage then for, I mean, the other thing that sort of, for somebody like me who's written about healthcare for a long time, I get into these kind of wonky distinctions of like, well, who's providing funding for anything? Mm-hmm. And so there's like I think President Pierce in the mid-19th century, there was kind of a precedent-setting decision for the federal government to not really get involved in funding mental health. And so it's left to states, and so states create these facilities. And with John F. Kennedy, the federal government kind of asserts a role and says, you know what, we're gonna put up some big money, and we're gonna help create an alternative system.
Right. So this is like 63 now.
Yep.
And Kennedy's like a key player. I mean, he actually sort of sets this new stage of what this might look like.
Yeah.
Community healthcare.
Yep, that's right.
And they're going to fund it. They're going to fund 1,500 of these centers.
That's
and then
right.
And also drugs are making a difference now.
Yep. In the mid-50s, antipsychotics come on. And so just by virtue of the efficacy of medications, some people who could not have, or who were confined to these institutions, they're able to live out in the community. And so there's a sense of hope, right? That, boy, if you create a safety net, if you create supports out in the community in conjunction with, medical advance, medication advance, there's a real opportunity. And so so Kennedy's kind of harnessing that optimism.
Yeah. We'll be right back.
At Primrose, our balanced learning approach means exploring academic skills and life skills, combining purposeful play with nurturing guidance from teachers, and setting children up for success in future classrooms. Learn more at primroseschools.com/Twin Cities. And
we're back. So what are these centers that the federal government is funding? I mean, you call them, they're community mental health centers. What is that? That's not an institution. This is something else.
Right. So it's been described to me as kind of like a one-stop shop for mental health, and in my mind, it's like a clinic. It's an outpatient place where you can go and get what you need and/or, get connected with what you need. I mean, the original vision that was spelled out also includes like inpatient care, that's hospital care. But what I think they're talking about is not, Fergus Falls State Hospital, but like, your general hospital in the community, which has some mental health beds. And, when needed, you're kind of directed there. So it's, and it's all with the idea of, like getting out of that general hospital and living in the community, with access to like the support in the clinic, but then also, and this is where, in 1963, I don't think they have like, they're not omniscient about exactly what's going to be needed. But I mean, what I think we've seen over the last 60 years, I guess, is that, boy, there are a lot of different things in this continuum of care that's needed, including like various degrees of like, live-in treatment kind of centers, day treatment centers, group psychotherapy, and an understanding that like people need employment if they can, or to be meaningfully occupied and connected with their communities.
Right.
And so there's a social service almost like. element here that people are recognizing, over time is like, oh boy, we really got to help plug folks into their communities in all ways, not just the care.
And so Kennedy and this initiative sort of gets the ball rolling, which then has this other effect of then emptying out the institutions locally, right? I mean,
that's right. Yeah.
So it's not that they're closed yet; they will, but like that they're starting to just lose all their patients.
Yeah, that's right. And there's like a shift going on too that makes it complex for me, or I found complex.
This whole story was complex.
Yeah, which is, you've got, as we mentioned earlier, I mean, there are a lot of folks in these facilities that don't have mental illness, including a number of folks with developmental disabilities. And, in Fergus Falls, I remember looking at records that, I think in the early 1970s, it was like a tipping point, and like the population of mentally ill was like in the minority, that developmental disabilities was the bigger group. So it's like the one group's getting smaller, the other group's getting bigger.
And I'm guessing the treatment is somewhat different.
Yeah, different treatments. And so in terms of the reader's question was about cost. And boy, like these facilities had to take on like different roles at different times. And if you're going to do it right, there are investments with all that kind of makes it hard.
And you quote here, I mean, and this is Susan Foote had talked to a former staff member at Fergus Falls who described watching these long-term patients. These are the mental health patients being discharged. And I'll just read this, quote, "One of them cried and said, 'We knew these people, we knew them really well, and we knew we were sending them to a place that was not going to work for them. On the other hand, there is a lot of anger toward the institutions as they existed.'" So there was sort of this feeling that this might not be the right place to be sending these people where are they sending them? Taking them out of these institutions in some cases.
Yeah. And that's part of the complexity of all this, is that there were real problems. Nobody wants to like kind of paint over the problems with the institutions. At the same time, there was, the community-based system was not built out.
Right. Well, that's what I was going to ask about, because then the federal funding doesn't sort of keep going, or the Kennedy vision doesn't get fully funded, right? And so, but you said like about half of these centers, these community mental health centers, actually got built.
That's right. Yep.
Okay.
Yep.
So there's just like not enough money now to figure out what the new thing is.
I think that's...
And we're in the 70s at this point.
Yeah. No, I think that's right. And I don't even know if all those centers had been built, would that have been enough? I don't know. I mean, It's hard to know in retrospect.
And you mentioned that so in the 70s, then we see an increase in homelessness, which is sort of corollary to this, or there's some link there.
Yeah. So the other kind of book that I relied on was by Dr. Tom Insel, who's a former head of National Institute of Mental Health. I'm a reporter, so how do I know anything? So in reading through his description of, I was a kid in the 1970s, so I don't have perfect recall on all this. But I mean, his description of it was compelling, and also, he talked about folks coming back from Vietnam and PTSD and just not really being able to plug into anything, all sorts of problems and homelessness.
Right.
He called it, I believe he used the word explosion. I mean, it was really...
Well, there was actually a comment on the story, and we can't verify this, but from Supervon 2, who wrote, "My brother was a Minneapolis policeman in that time. He said the police department became almost overwhelmed with a whole new group of people." So kind of backing that up of kind of just something shifted there. Okay, so then the institutions, they start to close entirely, in the late 70s and early 80s?
Yeah, that's right. Late 70s, early 80s for a couple of them. Let's see, Hastings and Rochester. Fergus Falls hangs on till 2005, which is, that's a lot of time. Yeah. Anoka is still there. St. Peter is still there, although really different than the way it started.
Okay, so fast forwarding, so that took us into the 80s. Now today, what is the landscape?
The mental health advocates keep pounding on at the state capitol and elsewhere is that, it's not that the system is broken. We never had a system to begin with, that there are just gaps in kind of the continuum for what folks need. And, the other thing is, we have a sense that since the pandemic, the demand for care has gone up, the needs have intensified, And, we also have, a private health insurance payment mechanism that, there's a lot of controversy around this, but the idea that a whole nother set of laws about what's called parity, that mental health care is supposed to be paid for the same way physical health care. And the advocates have long complained that health insurers haven't done it. Big fights over this.
And we actually got a question about that, which you might do another story on at some point. We got another curious question, follow-up question.
Right, because for me, when I reflect on like the 40s and 50s, the state of Minnesota would have had a big role in providing the care. When and how did private health insurance get in the mix, the funding mix? And, was it a reluctant, all right, we'll pay for it, or, I just don't know. I'm really interested to learn more about that piece because right now, when you think about like heart care or orthopedic care, that's all, a whole lot of that is like private employer-based
and the
healthcare.
reimbursement rates are much higher for those than, say, a mental health care generally?
Right. That's what we were writing about last year.
Okay.
Yep.
The question had to do with the savings and what was used with the money. Yep. And that's where things get murky. And you looked hard. Or the Legislative Research Library, Reference Library, looked hard.
I think part of it is there's a ton of financial data about these facilities. But in terms of like synthesizing data towards, answering a research question, we didn't find the tidy summary that said, here's what was saved, here's where that money went.
Right. And so you also note in the story that, okay, well, there's might be some instinct that we should reopen the institutions. Obviously, we've learned some lessons, so they wouldn't be the same type of places, hopefully. What's sort of the response to that from patient advocates?
Yeah, I think because of the history, and there's a great reluctance about it, but I think a lot of people, I think, would agree that like some level of more beds, but also more alternative, live-in facilities are probably needed. What's really hard, I think, from the advocates I've talked to is that there's been such a reflex towards just like, we don't want to deal with this, so we would just send these people somewhere else. And so I think there's a real concern that, when people talk about beds or these old hospitals, it's kind of what the real message is, let's create a place so we don't have to think about this problem anymore.
Because, that was sort of the criticism, even during Kennedy's era, was that we were isolating these people from society. Is there sort of a new model emerging? I think you mentioned in the story that there is some glimmer of interesting things happening in this space, but like what does the future potentially look like in this area?
Well, there are a ton of things that people are trying. The one that Tom Insel in this his book talks about that I'm sort of interested in is there's this idea of it's called a clubhouse, and it goes back to the 40s even, these clubhouses. But it does get to, it's not healthcare. It's about a place where folks can go to find community and to stay like positively involved in, it might do some things like job training stuff and more social service kind of stuff, getting you connected to what you need. But also just like, again, like having a place where folks with severe mental illness can, really stay positively engaged with their community and find community.
Right.
So that, they're not isolated, alone, and crisis builds, and then it builds. Then they go to the emergency room, and then they wait in the emergency room for days. Yeah, we didn't even talk about that,
but that's something that's happening a lot, is the emergency room is the...
Yeah. And so
place of last resort.
It's an idea that, like, in addition to like healthcare infrastructure to help you stay out of the hospital, which is like this, smile thing for all of healthcare, but it's also an idea that, like, for some folks with mental illness, really a community level supports to help folks stay out of the hospital is a big part of it.
Okay. Well, Chris, thanks so much. This is fascinating. You're holding 2 books in your hand because that was part of what you had to do to make this story happen, was read those books. So thank you for all your work putting this together.
Oh, thanks.
Okay, that's it for today's show. Thanks, as always, to Matt Gilmer for editing this podcast. Got feedback for us or a question you'd like us to tackle? Send us a note at curious@startribune.com. And if you're enjoying this show, please tell a friend about it. Thanks.
Thanks for listening to Curious Minnesota. We want to hear from you. Ask questions and read more stories online at startribune.com/curious. Our show is recorded at the Star Tribune's headquarters in beautiful downtown Minneapolis, and our music is produced by Matt Gilmer. If you like the show, please rate us on iTunes or leave a review. And until next time, stay curious.